Hi everyone and welcome to Isamu Rat Care. So today's video is a continuation of my series on books, and today's video is all about health issues. That's the kind of health issues that are typical to books in particular. So there's a lot of health issues that all rats get, and it's well worth being aware of those, and I'm trying to do kind of different videos on particular ones, but I'm just going to talk about the kind of considerations to think about when you own books and what to look out for in terms of health issues. So first thing to say is books on average in terms of health are cheaper to keep, and that's because the kind of health issues they get, there is generally a limited amount of things that you can do about them, and I say that in kind of a bit of an interesting way. So generally speaking, with books, most of their health issues that are more common in books than in does, actually they're kind of conditions that you manage through their life. They're not something that you can fix. So does kind of like more prone to tumours and such, you can get those operated. Books, it's very rare that you get an issue like that, or you can get issues like that, but it's more general rat issues than particularly book issues. So why is that, and what actual effect does it have? What effect it does have is, on average, books don't live as long as does, and there's only normally, I think, depending on the study you look, there's only normally like a month or two in it. It's not a massive amount, but it's noticeable when you keep them. They tend to pass a lot more often on their own as well. So whilst you still do have to put boys to sleep, I'd say I expect to do it with most of my girls, and with my books, quite often whatever issues they have, they can pass on their own, and you'll find them at home, which is probably better for the rat, not great for the human. It's a little bit scary. Let's not have that happen for a very long time. So yes, so that's one to consider. So why is that? So what health issues do they suffer from? The first thing to say, as with everything we've looked at so far in terms of boys, is their driving factor hangs around this testosterone, and that's all because of what they need to do in life. That idea that they go find a mate, create lots of babies, be a big, strong, kind of powerful individual and impregnate as many does as they can, and that's really what they're set up to do, and that's why they have this testosterone, to give them that kind of muscle mass and bulk up. But testosterone comes with its downsides. It tends to, because they're kind of put on this extra mass and everything, it puts a little bit of an extra strain on all of their systems, so it can kind of like affect a lot of things, and it means that things that do tend to be associated with kind of failing in older age in any rat are more common younger in books, and that's because of this kind of extra load, their extra mass, their extra muscle that they've got to carry around. So one of the key things that I find is very common in books is kidney degeneration. So I don't know if I've actually done a video on kidneys yet. I really should. I think I mentioned it briefly in both the HLD video and the urine kind of analysis video, which have been fairly recent. But kidney degeneration is basically, if you have a rat that you think's looking a bit old, they're getting a little bit skinny, they're not putting weight as much, the fur might get a little bit thinner, though that's not that common, I would say. You might notice Hind Leg Degeneration, another very common thing in books because it's kidney linked. The rat's moving a little bit slower, not as enthusiastic, generally they're showing their age. That is normally kidney degeneration. What I will say is there's no such thing as just old age as a kind of condition. It's basically a collection of symptoms and degenerations of various organs that kind of make an animal seem older, and it's the same with us. In rats, their weakest link is typically their kidneys, so that tends to be the thing that goes first, and it is more common in books. I would say in books over 18 months, it's fairly normal to have some degree of kidney degeneration. You might not be able to directly point at the symptoms, but they'll start having that going on inside them, and then gradually they'll start showing the symptoms. Hey, what can you smell? Is it good? Yes, they'll start showing the symptoms, and then the degeneration has progressed fairly fast. So how you find it in your rats is you test their urine. So if you have a look at the urine testing thing, I would recommend testing your boys maybe once a month when they're kind of like 18 months plus, seeing whether they kind of have the protein in the urine. And all it is the kidney is basically a glorified filter. It's filtering all sorts of crap out of the urine, and it just gets clogged up. It loses its efficiency, so more stuff gets in or gets straight through or doesn't get properly absorbed by the body, and that leads to all these symptoms. And it's something that is fairly common in older boys, so it's something to be very aware of. It's not the end of the world. Rats can live very happily on a kind of kidney friendly diet, which I really should do a video on. I think I've done one for older age. You lose track of what you've done. I know I've written plenty of articles in my life, but yes, so moving them on to a kidney friendly diet. In fact, I would recommend it if you've got books over 18 months, even without a kind of positive protein reading in the urine, then it's one to consider. Hld Hind Leg Degeneration is the other thing that is very much associated with kidney degeneration, also more common in books. All types of hind leg degeneration is more common in books, and that's because they're kind of like this bigger mass than a doe. They've got more to carry around, so it puts more kind of weight on the joints, on the connections and so on, so the weak legs can kind of kick in. And I would encourage any book owners to watch the video on hind leg degeneration, because unless you're very, very lucky or just don't spot the early signs, your old men are likely to have a degree of it. It is very common in older books. So that's the two kind of most common. Another thing to mention that's quite common in books is heart issues. So this is one that I don't actually see an awful lot of in my rats. I've been very lucky actually, but it is something that happens. And heart issues, there are various different types, but they can look a bit like a respiratory issue in that they can sound quite kind of congested, have difficulty, panting breathing is quite characteristic of heart issues. And they can, one of the really classic things that you see is the rat will run around really madly for a period of time, and then they'll just completely flump, flump being a very technical term again, and that will be because they are kind of worn out very easily, and they just need to kind of rest and regain their breath. So that's a really classic one to look out for, as is if you you sweetheart, what are you up to? Yes, that's my thumb. Sorry, Magpie's a bit of a sweetie really. Yes, so that's one that you need to kind of look out for in all boys, older boys actually, but actually girls too. And the other thing that you can look out for is they quite like to lie on shelves and hang their heads over it. Now I will say you can sometimes find a rat doing that anyway, and they'll do that generally in terms of if they've got something that's that they're kind of like struggling to breathe. It's quite a natural thing for them to do because it's a nice angle for their head and it keeps their throat maximally open. So it's one that they can do with heart issues. But if you see that, again, fairly treatable. You can get ACE inhibitors, and I think beta blockers can also be useful too. There's various options to treat that, and a diuretic which can help if they've got fluid on the lungs. It's really quite effective for that. So that's the kind of thing to think about with heart issues. I'm trying to think. Oh yes, somebody asked me on my Facebook page about that classic problems that you see with books which have penis issues. So something that as a rat owner, as a female rat owner, book owner, it's quite educational. The number of issues we've dealt with over the years. Let's see if I can catch somebody to volunteer. Nobody particularly likes volunteering for this. Currently Kipping I can't use you, Magpie, you're lacking the essential bits. But yes, so various different penis issues in there. Penis plugs is one that in older books particularly you need to be very conscious of. What I would do is have a look at the video I've done on that. It's only a short video and it just explains kind of how to check, which is effectively pop and then pop and it pops out. In older books they don't clean it very well. It can get little bits of kind of nice waxy deposit stuck in there. Other things to mention, if you notice that the penis is stuck out, this is a serious situation. We need to take it very seriously, because if the penis is stuck out it can dry out. If it dries out it can become blocked, and if it becomes blocked they have no way to pee. A rat that can't pee has got about 24 to 48 hours before their bladder fails and it will kill them. So it's quite an urgent situation, because you don't know how long that kind of rats being in that situation. So you get to the emergency vets, because what they can always do, even if they can't sort the penis out straight away, is they can at least check the bladder and whether it's full, and if the bladder is full they can manually empty it, which basically means, rather unpleasantly, getting in a kind of needle in there and drawing out the urine, but it buys you time to be able to sort it, so that's one to be very aware of. There are other things you can do. So if you just find it stuck out, then using a bit of olive oil or a bit of lube or something, wonderful things you do with male rats. Try to get it back in. Do that gently, obviously you don't want to hurt them. But again, it's important that that penis is not stuck out, because it's quite a dangerous thing for them. Other things to mention, testicles. So rats don't get a lot of testicular issues. Testicular tumours do come up now and again. I've had one in 30 odd years, but I haven't get that many books, I suppose, overall. They're not normally nasty tumours as these things go, and by nasty I mean cancerous. They're normally benign, they grow quite slowly, they don't tend to bother the rats particularly, but it's obviously something that you don't particularly want. So if the rat is young and fit, you'd get them castrated straight away. If they're older, it's kind of like a call to decide whether you think it's going to be a problem in their lifetime or not. Like I said, I've had one done. It was a 27-month-old buck. I had it removed. He was absolutely fine. Looking back, I probably wouldn't have had it removed. He died about 2 months later, and I doubt it would have grown substantially in that time. So it's a bit of a kind of juggle. They don't normally cause them too much trouble. And they don't cause pain, but they can also get things like a torsion injury where they twist one of the testicles, and that is horrifically painful, so your rat will be in a lot of pain if you see something like that. Or they can get an infection in there, so that might need antibiotics to treat. So anything where you're seeing a swelling or unevenness in the testicles, it's worth looking out for. I will say, if you notice the testicles get quite larger than normal and it's hot weather, that can kind of happen. They do kind of swell with heat, but obviously you don't want anything particularly abnormal or uncomfortable, so you kind of get to know them, which is something that's probably a little bit disturbing if you've not been a rat owner for long, particularly if you've not owned boys. It's one of those things you just find yourself naturally checking as you kind of stroke down the rat. It's kind of a natural thing to just check over there. You don't mind, do you, Bobby? As long as I pay you attention, you'll let me do anything. Yes, that's my nose. Yes, so that's one thing to consider with books. That's main things that I can think of for your particular anatomy. What else have we got on my list? I think that's actually probably covered most of the things. Now obviously we've mentioned neutering in terms of the behaviour side of things. I will mention briefly here what I would call elective neutering. So that's neutering not because of a particular emergent issue, so like a health issue, like a testicular tumour, or not because they've become an asshole and need to be removed. Please don't go in my ear. She's a real sweetheart, but she does like exploring things with her teeth, which when it's your ear, yeah, that's my nose, yes, yeah. She's now nibbling my nose. Yes, aren't you? It's like most rats would lick. Magpie doesn't quite understand this, so that's her affection. But it's I don't really want it by my ear, or particularly on my nose either, bless you. Go on. Yes, so distracted by Magpie, who isn't even a book, so he's faking this video. I have to try and remember what I was thinking. Oh yeah, elective neutering. So why would we electively castrate? So it doesn't have the same benefits that it would do for a doe, and I'll talk more about the doe benefits when we get onto the does round of these. I'm going to finish the boys off first. There should be one more left, and then we should be done on that. So in terms of health benefits, it will help, like if you get them castrated when they're, let's say, about 6 months, and that's as early as I would do it electively, because that gives them time to kind of fill out and kind of turn into proper men. So Kip's probably about 5 months, getting on to 6 now. He's physically quite a good size, he's got a bit of mass to him. He's got a bit of filling out left to do, but that's absolutely fine. So that kind of the age you want them to be a kind of substantial buck before you remove them of their main source of muscle building testosterone. So you castrate them at that age, and it will obviously remove the chance of testicular tumours, which is pretty uncommon anyway. but it will also remove some of that load from the extra testosterone. So they're likely to live a little bit longer, though I will say studies are fairly divided. I find studies that found they live 1 or 2 months longer and studies that find they've lived 1 or 2 months shorter. So in reality, you're not going to do it for a kind of longevity point of view because it's not really conclusive. It does tend to delay the onset of things like kidney degeneration and hind leg degeneration. So that does push it out a little bit longer, but not substantially. And Burko is clearly castrated. He has hind leg degeneration at the moment, and I'm pretty sure he's starting with kidneys now. He's starting to lose weight a little bit. Hasn't stopped him fighting with one of the babies over the water bottle. This is them kind of like faffing around now. Burko 1, you'd be pleased to know, all those Burko fans. But yes, so it doesn't have a massive impact from that. What it does prevent is any kind of behavioural, well, when I say prevent, it reduces the chances of any kind of hormonal behavioural issues. And that is a consideration, particularly if you're getting your rats from a source where they're not bred for kind of temperament. So when you're breeding, and you're breeding particularly bucks, you need to take into account how they cope with their hormones. So obviously Eclipse has gone through a bit more of a turbulent teenage period than Sol did, and because of that reason I've not bred on from him. As much as you are the more physically pretty rat, yes you are, he's a much nicer rat, but it's just one of those considerations. I've got his brother who's a perfectly nice rat and has dealt with his hormones a lot better. So that's something that you do tend to want to take into account. So if you're getting rats from a source that doesn't do that, then there is a higher chance of you having hormonal issues in your kind of boys. And some people, particularly if you're getting rats, like there's for those of you not in the UK, there's a kind of chain of stores here called Pets at Home, and wherever they get their rats from, they do seem, particularly in the northwest of England, there seems to be a high percentage of them that end up needing castration, like quite high. You see a lot come up into rescues and that kind of thing. So if you're getting your rats from like an adoption centre from Pets at Home and you already suspected they might have a little bit of problems, it could be worth considering from that point of view, because you remove that kind of potential problem and the impact that it will have on the group. So kind of avoiding that. I'll be honest, the main reason though that most people choose to electively castrate is so that they can have a mixed group, because the castration op is much more minor as these things go than the spaying op. So if you're going to want to neuter one sex in order to keep a mixed sex group, generally that should probably be the male, because whilst it doesn't have as much health benefits, it's not a particularly bad op, you know. It's quite minor, it's not intra-abdominal, so anything that goes into the abdominal cavity is riskier. The complications can be much more severe if they happen, so generally it is a more minor one. However, you do have to weigh up whether your want for a mixed sex group outweighs the kind of risk to the rats, because rats do die in castration operations. It's not that common. I think when we did the survey on Rat Care UK, it was, I can't remember if it was 5 or 10 out of the 200, but it was quite a low percentage that did die in the operation, but it's still a percentage, if you know what I mean, it's still a risk. So you do need to weigh that up. Or alternatively, do what I do from my mixed sex groups, which both are mixed sex, and I wait for a rat that would benefit from it. And otherwise I don't have a mixed sex group. So Burko needed castrating, and I jumped at the chance to have him join the girls, and actually that's really worked out for him and the girls. And the same with Magpie, she came as a spayed doe that had been beating up another doe, so put her in with the bucks, and it's been good for her and good for the bucks as well. So looking out for that. They don't come up hugely often, particularly not spayed does, they're not as common as castrated bucks. But if you're around a rescue pages, then it is quite common to have bucks that don't get on with other bucks that might benefit from castration, so it's worth keeping your eyes out. But yes, one to think about. So it's not really for health benefits as such, it is more for kind of hormonal benefits. There's some benefits, but they're not substantial, and they probably don't outweigh the risk of surgery in terms of the actual direct health benefits. But definitely one to consider, you know. There you go, Magpie. So that's it really from a health point of view. So really quick summary. Bucks on average don't live as long as does. There's not loads in it, but there is a couple of months on average. And I will say you'll get some really, really old bucks, you'll get some really, really young deaths in does, but that's kind of like your averages. They are more prone to issues that you can't really fix, you can only manage. So kidney issues you will kind of manage with a good diet and perhaps some medication as well. Heart issues you will manage with long-term meds, but you can't fix them. That's it, they're just on those meds for life to keep them as comfortable as possible. Hind leg degeneration you'll manage with a good diet, enough exercise and a kind of adapted setups where necessary. So those are your kind of three main ones, and you can see there's nothing you can really do to fix those. Once they're there, they're there. But that doesn't mean they can't have a lovely life. They may pass at home, which is not a bad thing. I've often thought some of my best rat deaths, which sounds a really kind of sad thing to talk about, but genuinely is from their point of view, have been kidney related. You just come home one day, I mean, usually about a week before I get an inkling that it might be time. What I find is they've been losing weight gradually, and then about a week or two before they're going to pass, they start putting on weight. They start feeling kind of broader, particularly around the chest and the kind of body, and that's actually them retaining moisture fluid. So they kind of they're not getting fat, they're getting heavy from the kind of fluid retention. And then soon after, and there's nothing you can really do about it, they just peacefully pass in their sleep in the group, normally cuddled up with the rest. It's not a bad way to go for a rat as these things go. Though it is very sad to find. But yes, so that's the kind of thing you do experience more of in bucks, whereas in does, typically they're stubborn little bastards that hang on, and you're like, you really don't want to have to make that decision. You'd love it if they just pass sleep peacefully in their sleep, and no, they're going to make that decision and have them put to sleep. But yes, so it's one of the kind of pros or cons. I'll let you make your mind up on that one. But yeah, so those are the main things to think about from a health perspective for bucks. There is a few things that will fall into the next video, which is going to be kind of on diet, and I'll talk a little bit about kind of environment, cage setup as well. I think they can probably both fit into one video. I've talked enough about bucks. Amusingly, the first video I did, which I didn't put up because I thought an hour-long video on boys was too long. Now the 3 constituent videos I've done so far have definitely exceeded that. But let's just say I like to talk about boys. Sorry, you're a magpie, not the face. You can tell either have I just had some ice cream, and Magpie clearly desperately wants the ice cream, or you're after trying to nibble my nose again. I'm not sure which. Let's put you down there to save my face. Oh, she's now she smelt like, it's like kind of like raptors in Jurassic Park. She smelt ice cream, and all she wants now is to try and eat my face. Yes, you want to eat my face? Right, let's go before Magpie does eat my face. So thank you very much, and see you next time.